At 72, Robert Harrison still climbed the small ladder behind his house every Saturday morning to trim the climbing roses. His wife often joked that retirement had only made him busier, not older. Robert considered himself healthy. He stayed active, rarely missed family gatherings, and believed that if something serious were wrong, his body would surely let him know immediately. Then, during his annual wellness visit, his physician recommended repeating a routine kidney blood test. Robert wasn't frightened. He was simply puzzled because nothing seemed different about his daily life. His doctor explained that kidneys often change quietly over time. Many people continue feeling perfectly well while routine medical tests reveal changes that deserve closer attention and careful monitoring. Robert drove home asking himself one question. If kidneys can change so quietly, what small clues might people overlook every day without realizing they deserve a professional conversation? Today's documentary isn't about creating fear. It's about recognizing patterns, understanding your body, and knowing when small changes deserve a conversation with your healthcare professional rather than being ignored. Before we begin, remember that every warning sign discussed today has many possible causes. Only a qualified healthcare professional can determine what's responsible for symptoms through proper evaluation and appropriate medical testing. A few weeks later, Robert noticed he was getting up to use the bathroom more often during the night. He blamed drinking an extra glass of water before bedtime. Occasional nighttime urination is common and may result from fluid intake, medications, diabetes, prostate enlargement, bladder conditions, or sleep disorders. Sometimes kidney problems are another possibility worth discussing with a healthcare professional. Robert asked, "Should I be worried?" His physician smiled gently. One symptom alone rarely tells the whole story. Patterns, medical history, and appropriate testing always provide a much clearer picture. Instead of searching online for answers, Robert wrote down when the symptom occurred, whether it was becoming more frequent, and shared those observations during his next appointment with his physician. Robert believed the nighttime trips were the entire story. He had no idea another subtle change was quietly developing during the daytime. One afternoon, after working in his garden, Robert removed his shoes and noticed deeper sock marks around both ankles. He smiled and blamed the summer heat, assuming it was nothing worth mentioning. Mild ankle swelling has many possible explanations, including standing for long periods, hot weather, vein problems, certain medications, heart conditions, and kidney disease. A healthcare professional considers the entire picture before identifying the cause. Robert asked whether occasional swelling always meant something serious. His physician explained that temporary swelling is common, but persistent, worsening, or unexplained swelling deserves professional medical evaluation instead of self-diagnosis. Rather than worrying, Robert simply recorded when the swelling appeared, whether both ankles were affected, and how quickly it disappeared. Those details later helped guide a more productive medical conversation. Robert thought two small changes were merely coincidence. Then another subtle difference appeared, one that slowly affected how energetic he felt during ordinary days. A few weeks later, Robert noticed that mowing the lawn left him more tired than usual. He still finished the job, but recovering seemed to take noticeably longer than before. Unusual fatigue is one of medicine's most common symptoms. Poor sleep, anemia, thyroid disorders, stress, medications, infections, depression, heart conditions, and kidney disease are just some of the possibilities doctors carefully evaluate. Instead of guessing, Robert rated his daily energy from 1 to 10 in a notebook. Over several weeks, simple patterns became much easier to discuss during routine medical appointments. Myth: feeling more tired is simply part of getting older. Reality: persistent fatigue has many possible causes. Rather than accepting it as normal, discuss ongoing changes with your healthcare professional. Robert realized he wasn't collecting symptoms. He was collecting information. Together, those observations painted a clearer picture than any single change could ever provide by itself. Just when Robert believed he understood his body again, he noticed something so ordinary that most people would never think to mention it during a doctor's visit. One Saturday morning, Robert's wife noticed something unusual after he flushed the toilet. The water looked slightly foamier than normal. Robert laughed and blamed the stronger flush. Foamy urine isn't automatically a sign of kidney disease. It may happen because of a forceful stream, temporary changes, or other harmless reasons. Persistent foamy urine, however, deserves medical attention and proper evaluation. Robert asked whether he should worry after noticing it once. His physician explained that isolated observations rarely provide answers. Repeated patterns over time are far more meaningful than a single unusual occurrence. Instead of becoming anxious, Robert simply noted the date. Weeks later, those simple notes helped him answer questions more accurately during his follow-up medical appointment. Robert still believed these changes were unrelated. Then another subtle difference appeared, this time during family dinners, and even his wife quietly began paying closer attention. Robert gradually realized he wasn't finishing meals the way he used to. Nothing tasted unpleasant, yet his appetite seemed smaller than it had been only a few months earlier. Changes in appetite may occur for many reasons, including digestive disorders, medications, infections, emotional stress, dental problems, or kidney disease. That's why healthcare professionals evaluate appetite changes alongside many other important findings. Robert began weighing himself once each week under similar conditions. He wasn't trying to lose weight. He simply wanted an accurate record to discuss with his physician if anything continued changing. Myth: if you're still eating every day, appetite changes aren't important. Reality: persistent appetite changes deserve attention because they may reflect many different health conditions requiring professional evaluation. By now, Robert understood that no single symptom told the story. Small changes, routine testing, and honest conversations together provided a far more reliable picture of his overall health. Robert thought he had noticed every important clue. Yet one of the most overlooked warning signs was about to appear, and it had nothing to do with pain. Autumn arrived, and Robert was preparing his backyard for winter. While carrying a small bag of garden soil, he stopped halfway down the path, surprised that such an ordinary task suddenly felt unusually exhausting. His wife asked if he was feeling all right. Robert smiled and blamed getting older. Deep down, however, he quietly admitted this kind of tiredness didn't feel quite the same as before. That evening, Robert began wondering whether several small changes were connected. The answer didn't come from another symptom, it came from something he had overlooked for weeks. As he reviewed his notes, Robert realized one detail kept appearing again and again. The unusual tiredness seemed to arrive on the same days his ankles looked slightly more swollen. During his appointment, Robert's physician explained that doctors rarely rely on isolated symptoms. Instead, they look for patterns, timelines, examination findings, and test results before considering possible explanations. A few mornings later, Robert noticed his face looked slightly puffier than usual after waking up. By lunchtime, it had mostly disappeared, making it easy to dismiss. Morning facial puffiness has many possible causes, including allergies, sinus problems, sleep position, medications, and other medical conditions. Persistent or recurring swelling is another change worth mentioning during a medical appointment. Robert began taking a quick photograph whenever swelling appeared. Comparing pictures over several weeks helped him describe changes far more accurately during follow-up appointments. Myth: if swelling disappears later, it can't be important. Reality: some health conditions cause swelling that comes and goes. Tracking recurring changes helps healthcare professionals recognize meaningful patterns over time. Robert no longer ignored the small changes. Instead, he became curious. Understanding what his body was telling him felt far more helpful than guessing or searching alarming stories online. Robert believed he'd finally shared everything important. Then his physician asked one unexpected question that completely changed the direction of their conversation. Instead of asking about Robert's kidneys first, his physician asked a surprising question. "Have you noticed any changes in your urine besides getting up more often at night?" Robert paused before answering. Robert remembered that his urine sometimes looked noticeably darker during the day, especially after spending several hours working outside. He had always assumed he simply needed to drink more water. Urine color can change for many reasons, including hydration, certain foods, vitamins, medications, or medical conditions. Persistent or unusual changes are another reason to mention them during a healthcare appointment. Robert's physician explained that describing changes accurately is often more helpful than guessing the cause. Simple observations allow healthcare professionals to decide whether additional evaluation is necessary. Robert believed he'd remembered every important detail. Then his wife quietly mentioned something he hadn't noticed about himself for several months. She explained that Robert had occasionally seemed less focused during conversations. He wasn't forgetting important memories, but he sometimes needed questions repeated before answering, which felt unusual for him. Difficulty concentrating can result from poor sleep, stress, medications, depression, vitamin deficiencies, infections, and many other health conditions. Kidney disease is only one possible explanation among several that physicians evaluate. Robert started bringing his wife to important appointments. Together, they remembered details that either one alone might accidentally overlook during conversations with healthcare professionals. Myth: if memory changes are mild, they're never worth mentioning. Reality: persistent changes in thinking or concentration deserve discussion because many different medical conditions may contribute. Robert appreciated that his doctor never jumped to conclusions. Every conversation focused on gathering facts, reviewing patterns, and deciding together whether additional testing or follow-up made sense. Just when Robert thought the evaluation was finished, his physician shared one final observation that every adult over 50 should remember for the rest of their lives. As spring returned, Robert was back in his garden planting tomatoes. While kneeling beside a flower bed, a sudden cramp tightened his calf, forcing him to stop and stretch before continuing. Occasional muscle cramps are common, especially after exercise or dehydration. However, frequent or persistent cramps may have many possible causes, including medication effects, electrolyte imbalances, circulation problems, or kidney-related conditions. Robert's physician explained that muscle cramps alone don't identify a specific illness. Instead, they become more meaningful when considered alongside other symptoms, medical history, examination findings, and appropriate laboratory results. Looking back over several months, Robert realized none of the individual changes had seemed dramatic. Together, however, they formed a pattern that deserved professional attention instead of continued assumptions. Robert created a simple one-page health summary before each appointment. It included medications, recent symptoms, questions, and important dates, making every conversation with his physician more organized and productive. Myth: if symptoms appear gradually, they're probably just normal aging. Reality: gradual changes may still deserve medical attention. Recognizing patterns early helps healthcare professionals evaluate concerns more effectively. Robert's physician ended the visit with one sentence that stayed with him long after he returned home, and it may stay with you as well. He said, "Healthy aging isn't about worrying over every symptom. It's about paying attention to meaningful changes and asking questions before small concerns become bigger ones." Driving home, Robert felt something unexpected. He wasn't leaving with fear about his kidneys. He was leaving with confidence because he finally understood how to work with his healthcare team instead of guessing alone. Robert's story was ending, but one final message remained, perhaps the most important lesson anyone over 50 can carry into the years ahead. Several months later, Robert was back where the story began, trimming the climbing roses behind his home. The work hadn't become easier because he ignored his health. It became easier because he paid attention to it. His routine hadn't changed dramatically. He still enjoyed gardening, family dinners, and weekend walks. The difference was that he no longer dismissed subtle health changes or postponed conversations with his healthcare team. Robert learned that protecting kidney health isn't about searching for one alarming symptom. It's about recognizing meaningful patterns, attending routine checkups, and allowing medical professionals to interpret the complete picture. Before saying goodbye, Robert's physician offered one lasting reminder. Your kidneys rarely ask for attention with loud alarms. More often, they whisper through small changes that deserve thoughtful conversations rather than unnecessary fear. One final thought remained. It wasn't about Robert anymore. It was about every viewer who might recognize one of these changes in themselves or someone they love. If you've noticed one or more of these warning signs, don't assume the worst. Many conditions can cause similar symptoms. Instead, make a note of what you've observed and discuss it with your healthcare professional. Sometimes the most important step isn't finding answers online. It's asking the right questions, sharing accurate information, and giving your healthcare team the opportunity to help before problems become more serious. If this documentary helped you better understand kidney health, consider sharing it with someone you care about. You may help a friend or family member recognize changes worth discussing during their next routine medical appointment. This documentary is provided for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult your physician or another qualified healthcare professional regarding symptoms, medications, medical concerns, or treatment decisions.